This is inline SVN. Okay. Now, whenever you do a treatment inline, it's not much different than doing the treatments out on the floor, except that you're going to attach it now to the ventilator. You still need to get the nebulizer, okay, and you'll need to attach it to the nebulizer drive here on this machine, and you would place this on the inspiratory limb as close to the patient as possible, down here by the patient Y. Okay, you place the medication inside, whatever it happens to be. Okay, and now, before you give the treatment, you need to do certain things that you always do in the ICU. I would need to check my heart rate. I would need to check my blood pressure, saturation. I would look at my machine, see what my tidal volume and my respiratory rate is. Okay, because these are my baselines. I would also need to auscultate my patient to get their breath sounds. Okay. At that point, once I have my baseline, I would go ahead and turn my nebulizer on. And in this case, the nebulizer drive is built right into the machine. Okay, and it'll power the nebulizer on inhalation only, and you don't have to really worry about that part of it. You don't have to worry about stimulating your patient, take a deep breath, whatever. The machine will take care of that. Your job is to simply watch and make sure that your patient's not having any adverse reactions, checking their heart rate, their blood pressure, their saturation. Once again, keep an eye on their peak airway pressure and their tidal volume. Okay, mid-assessment again, checking the heart rate, etc. Now the ventilator will power this nebulizer depending on how much medication. Once again, anywhere from 10 minutes to about 12 minutes, depending on how much you have in there. Once it's over, then you would turn off the nebulizer, take it out of the line. You would then clean it up just like you did all the other nebulizers, rinsing it out with sterile water and placing it on the side. Then I would need to reassess my patient one last time now. So I need to check their heart rate, their their heart rate, their blood pressure, their saturation. I would look at the PIP and the tidal volume. Now, if the medication's having any effect, depending on how fast it takes effect, it might be that the PIP, you might see the PIP coming down. If the patient's having a paradoxical reaction, you might see the PIP going up. If they're in volume control, though, remember the volume should stay the same. The volume should stay the same, but the PIP might fluctuate. If they're in pressure control, then the pressure should stay the same. You might see more volume if the patient's having a positive reaction, maybe less volume if they have bronchoconstriction because of the resistance. But these are the things that you need to check. Okay, auscultate your patient again to check the breath sounds and make a note of what's happening, either to the PIP if you're talking about volume control, or the volume if you're talking about pressure control. Okay, now there are some machines, the 840, the Avia, that do not have a nebulizer built in. Okay, in that case, I would need to hook the nebulizer up to a flow meter, an external gas source. Hook it up to the flow meter, turn it on to the 6 liters per minute that I would drive. But I would do all the same things, checking my heart rate, my saturation, my blood pressure. But when you hook it up now, that extra flow is going to add more volume. So I actually physically have to turn down the volume until I match the volume on my machine to the order. So if I'm getting 1,000 milliliters and I use a Avia and hook it to the external gas source, turn on the 6 liters, I might see, 1,600 milliliters, well that's too much. And I would need to alter my volume and turn it down until it came back to 1,000 milliliters or whatever the order was. After that, everything is the same. I would continue to monitor all the same parameters, except when I finish and I turn the flow meter off. Now I need to readjust my volume and turn it back up again on the setting, back to the ordered volume. That's the only trick. If you don't do that, then the patient will not get enough volume. Okay, that's why it's always important. Heart rate, saturation, blood pressure, tidal volume, and PIP. Check those things on your machine. Okay?